I'm the medical director of the Living Kidney Donor Program, and when I did another paper a couple of years ago, I was looking at outcomes of African American kidney donors, and part of the baseline demographics of that study, I looked at just outcomes of kidney function in African Americans and Caucasians at our center, and found there weren't any significant racial differences in kidney function and blood pressure changes within a year after donating. But looking at the baseline demographics, I noticed that more of the African American donors were men, and looking, which is an unusual finding because worldwide most donors are women. And I noticed that just in looking through and reading about the donors that, gosh, all the African Americans seem to have some sort of relationship, with the recipient, and decided to explore that more with that study. I looked at relationships in African American and Caucasian kidney donors, and looked at differences. And what we observed was that African Americans were much more likely to donate to family members when compared to Caucasians. And if they weren't related to the recipient by blood, there was a familial relationship, and that maybe it was a spousal donation or an in-law relationship. And what we found was that 95% of the time that African Americans had some sort of familiar relationships with the recipient. And so out of, I think, 73 African American donors that we had at our center during the study period, only 4 did not have an existing familiar relationship with the recipient. And when they didn't, it was a close friendship. So it appears that whites more commonly reach out to friends or church members than African Americans, and I found that very interesting.